I'm happy to introduce our first speaker. This is Dr. Brady Laughlin, and he's going to be presenting attitudes and perceptions of the Reflect Communication Curriculum for Clinical Oncology Graduate Medical Education.
Thanks for the introduction. I'm excited to share our work today. So as we know, as oncologists, we play a multifaceted role for patients and their families, and communication is a crucial skill for oncologists. But there are layered complexities when we're meeting patients for the first time. They're handling uncertainty in their lives. They're facing challenges with their livelihoods and survival. It's noted that patients often report unmet needs when it comes to discussing things such as their diagnosis, prognosis, details of treatment, and toxicity. And patient experience is an important metric in healthcare, and specifically in oncology training in all fields. The evaluation of bedside manner, communication, and receiving feedback can be quite challenging. So the Reflect curriculum is a novel communication curriculum which set to improve communication between physicians and patients, specifically for oncology trainees. This was initially designed for a radiation oncology program of 4 residents. Given the interest, it was subsequently expanded to include hematology oncology fellows. So this was started in 2018 and has subsequently gone on for 5 to 6 years. The curriculum entails of 4 quarterly workshops per year, which are 4 hours each in length. They're designed to provide a controlled setting to deliver feedback. Each workshop includes a lecture or a patient panel with discussion and review of movie or video clips. Additionally, trainees would then undergo a videotape simulated patient scenario, and they receive structured feedback from faculty, patients, and their pupils. So the communication curriculum has had many sessions over its run. We've tried to implement basic topics such as delivering bad news, as well as encountering a challenging patient. But we've also had more specified topics such as managing conflict with colleagues, honoring cultural and religious preferences, and defining boundaries with the patient. So for this study, we sought to ask trainees and faculty how they felt about the curriculum. So we sent out a 7-question scale survey, which was distributed to resident and fellow participants and faculty mentors who at least participated in 1 workshop. Questions asked trainees and faculty about the perception of improvement in communication, handling of stressful situations, the value of the curriculum, and overall impression of the curriculum. We used descriptive statistics to determine the baseline characteristics of the surveys, as well as a Kruskal-Wallis test to compare differences between faculty and residents, as well as radiation oncology residents and HEMONC fellows. The survey was distributed to current and past participants who could be contacted back in September of 2022. The response rate was 13 of 16 trainees, 6 of which were radiation oncology residents and 7 were HEMONC fellows. And then 9 of 13 faculty physicians, 8 of which were radiation oncologists and 1 which was a HEMONC physician. So taking a look at the results of the trainee survey, we can see that most of the trainees had a favorable response with a score of 3 to 5 for all of the questions. However, there was at least 1 trainee and up to 5 trainees who scored a 1 or 2 for all of the questions. Looking at the faculty survey, all of the faculty scored with a 4 or 5 to all of the questions. And in fact, most faculty rated the questions with a score of 5. So looking deeper and comparing the 2 different groups, faculty and trainees generally felt that the curriculum increased communication skills, but faculty responded more favorably to the program's impact on communication skills with a median score of 5 versus 4, and this was statistically significant. Faculty were also more assertive about the curriculum's capabilities to improve a learner's ability to handle stressful situations, median of 5 versus 4, and this was also statistically significant. Additionally, faculty had a more favorable overall impression of the Reflect curriculum than the residents and fellows, with a median score of 5 versus 4, also statistically significant. We also sought to compare radiation oncology residents and hem-onc fellows to see if there was any differences in how they felt. In general, radiation oncology residents felt more strongly that the curriculum enhanced their ability to handle stressful topics with a median score of 4.5 versus 3, but this was not statistically significant, but still a noted difference. Radiation oncology trainees felt more consistently that the workshops improved their communication skills compared to hem-onc fellows, median score of 4.5 versus 3.5. Again, this was not statistically significant, but it's a noted difference. And the overall impression between radiation oncology residents and hem-onc fellows was similar with a median score of 4. We also got written feedback from the trainees. Several medical oncology fellows noted that the participation should be kept to the early years of training. Specifically, one comment had mentioned that medical oncology fellows may not get as much benefit from the curriculum as they get more communication training during their internal medicine years of residency. An additional comment noted that the workshops could be shorter in length, less than 4 hours. In addition, and then all faculty comments provided praise for the curriculum. So even though there was not consensus, overall the trainees felt that there was a positive impact on communication skills. Faculty physicians felt that the curriculum was beneficial in terms of improving communication skills and additional aspects of training. A significant difference between the faculty and resident fellow perception may stem from the experience that's gained over time by faculty. One of the things that we like to note, though, is that communication is a skill that's continuously developed and enhanced over time. And we think that the trainees may notice or feel a benefit from the curriculum in the later stages of their careers. The study has helped identify the limitations of the REFLECT curriculum. The program was initially designed for a small radiation oncology program of 4 residents, and this really allowed for a safe space for sharing, for more reflection. The program was then expanded to include hem-onc fellows because they were interested in participating in the program. And so if you can imagine, if you have more people, it just creates more challenges for sharing and reflecting upon certain topics. Additionally, hem-onc fellows did not consistently attend the workshops. And so because they did not consistently attend the workshops, they may not feel that longitudinal benefit from attending multiple workshops. Additionally, this all kind of a big portion of the curriculum took place in the COVID pandemic. And so because of the pandemic, we had to do workshops virtual for a period of time. The actual in-person component, which was a standardized patient encounter, we had to enforce social distancing. People were wearing masks. So you could imagine there could be some dissatisfaction with having to attend a seminar when you're dealing with those barriers. So in conclusion, overall, the perception of the REFLECT curriculum is that it did enhance communication skills of the trainees. That trainee and faculty physicians felt that the curriculum was beneficial. And as interactive skills and communication is important to build positive interactions with patients, our goal is to continue to do work to improve the REFLECT curriculum. And I would just like to thank faculty mentors at Mayo Clinic for one, creating the REFLECT curriculum, and then two, giving me the opportunity to share the great work that we've done.